Impetigo by Rebecca Hornung. Impetigo is a skin infection that is highly contagious and presents as red sores, normally on the face, hands, and feet. The most common cause of impetigo is a bacterial infection such as Staphylococcus aureus or Streptococcus pyogenes. The bacteria infects the epidermis, or outer layer of skin, normally after gaining access through minor cuts, insect bites, or a rash. Primary impetigo is when the bacteria invade healthy skin, and secondary impetigo is when the bacteria invades damaged skin. There are three forms of impetigo, including non-bullous, bullous, or ecthyma. Non-bullous starts as vesicles that come together to form one large vesicle. The vesicles rupture and spill out an exudate that forms the honey-colored crust that is typical with impetigo. The exudate then spreads and forms satellite areas that start the invasion process all over again. In bullous impetigo, small vesicles become bullae or blisters that rupture, leaving a red rim around the scale. Ecthyma is a form of impetigo that affects not only the epidermis, but the dermis as well and causes ulcerative lesions. The lesions can have the honey-colored appearance, or they can be black or brown and may have purulent drainage. The most common signs and symptoms are the small red vesicles that eventually rupture, leaving the honey-colored crust and itching, which leads to further spread of the infection. Impetigo is highly contagious and is normally spread through contact with an infected person or potentially from something that they have touched, such as towels or clothing. Diagnosis through examination from a physician, and lab tests are not normally needed. Treatment includes antibiotic cream or ointment that can be applied to the sores. Depending on the severity, oral antibiotics may be recommended as well. If the sores are not healing, a sample may need to be taken to confirm the specific bacteria causing the issues, so a different antibiotic can be prescribed. Preventive measures include proper hand washing, washing anything that the person had used prior to anyone using the same stuff, wearing gloves when applying the antibiotic cream, keeping the skin as clean as possible, and covering affected areas to decrease the spread. Resources.